Hello, everybody. We have discussed about the biomedical waste and what is a hospital and health care waste in the introduction as well as in the first unit. Now we are starting and moving to the second unit, which is categorization of healthcare waste and healthcare waste management process. So under this, we will be learning about, again, we're going to see what is a biomedical waste definition, and we will once again revise about different terminology that we are going to use uh, under the biomedical waste management. And also we will see the main importantly, the categorization of biomedical waste as well as uh, the processing. Okay, so we will see the management process, how we are going to manage each separate category of the biomedical waste. Okay, let's start. So nobody likes the waste, any waste that it might arise from a house, like domestic waste or non-hazardous waste, as well as the waste that come from the hospital, that is called biomedical waste. Nobody want it to be, uh, put aside within the own house or within the hospital and run it over. Okay, everybody want to know that how we need to dispose or how we need to process it, right? So we will see what is a management process also in this. So basically, in order to understand the biomedical waste completely, it is been divided into three categories. Before that, we will see the definition again. Biomedical waste means any solid or liquid. If you can recollect the definition once again, what we have learned last week, you can do that. It is a solid liquid or a liquid waste. It is a solid waste or a liquid waste that produced during the diagnosis, treatment, or vaccination of human beings or animals. These biomedical waste creates hazard due to two principal reasons. One is infectivity as well as toxicity. Okay, so we are calling it as a biomedical waste. It is a waste that is coming out of a medical process. It includes revaccination, it includes the diagnosis of certain condition, it also includes the treatment. So any management that is happening within the hospital and healthcare setting, and that management is producing a certain kind of waste. It could be a solid waste or a liquid waste, both will come under this. And why we are calling it as a biomedical waste and why we are categorize them into the separate categories, because there is a chance of that waste giving us the infection. Okay, so there is a term called infectivity and there is also a term called toxicity. Some of the waste may not give us any infection or it doesn't have a contamination process, but they might cause the toxicity to our own body. Like example, you take a genotoxic waste, you take a chemical waste, any kind of radioactive or chemical waste. So that itself doesn't cause any infection or cause any kind of pathological condition in us, but they directly act on the cells, the body cells, and react, causes the reaction in which our body cannot um, cooperate the process that gives us. So we will see. So this is a definition which we have seen already, and we are going to revise that. We have revised it again. So as I said, there are three different kinds of medical waste have been divided. Number one, it is there in your book as well, biological waste, which is the infectious waste. Number two is general waste. Under the general waste, you have the pharmaceutical waste, radioactive waste, as well as the chemical waste. And third category is non-hazardous waste. That is what is given in your book. As you look at the picture, there are different kind of waste also is being disposed. Number one is waste of sharps, that is a sharp waste, and discarded medicine, which is a pharmaceutical one. And human anatomical waste, where there are tissues, tumors are included, and solid waste, which includes all kind of solid material. Okay, next. Okay, so we have seen in the previous class as well in the unit one that what are the sources. We don't have to go into the details again. The sources of waste have been classified into two major sources and the minor sources. Major sources are the big hospitals, including the government hospitals and private hospitals and nursing homes, etc. And coming to the minor sources where they produce a little amount of waste, which includes the clinics and private homes and nursing homes. Okay, so before we move on to the further, we all know that there are sources, and we will see certain terms and definitions which are given in your book in page number 15. It is according to the rules given in 2016, the biomedical waste management. They have given certain terminology. We will see what are the terminologies. Number one is authorization, which are not included in the slide since they are given. They're only the terminologies. We will just discuss as they're mentioned in the book. Number one is authorization. If you're trying to take the notes, you can take a notes. Authorization means permission granted by the prescribed authority for the generation, collection, reception, storage, transportation, treatment, processing, disposal, or any other form of handling of biomedical waste in accordance with these rules and guidelines issued by the central government or Central Pollution Control Board, as the case may be. Okay, so what is authorization? Every hospital or every nursing home or a clinic should have authorization, like they should give us the authority to any clinic or any hospital. Okay, so what is authorization? It is a permission that we are giving a grant or a permission that where we can participate into different category of biomedical management process, which includes collection of waste, which includes the reception of waste, storage of waste, and transportation of waste. So all these are permitted in certain hospital or certain clinics. So if you want to practice that, you need to have a permission through this according to the guidelines given by the biomedical waste management rules. Next one is authorized person. But person is a prescribed authority is giving that particular person where they collect, receive, store, transport, treat, and process, and dispose and handle. So these terminologies, as I said, they're not included in the slides. You can have a look in the textbook. So since these are terminologies, I've not given much of a, you know, the slides thing where we don't have the proper pictures for that. So their biological wastage, it meets an appreciation made from organization or I repeat, biological means any preparation made from organisms or microorganisms or products of metabolism, biochemical reactions intended for use in the diagnosis and immunization or treatment. Right. As we are discussing about the definitions, various terminology that we are using in the process of biomedical waste. So here we have seen what is authorization. We also have seen who is the authorized person. The person is nothing but a person who is an occupier and operator authorized by the authoritative body or who has been given the authorization in order to participate in biomedical waste management process, which includes collection of waste, which includes the reception of waste or receiving the waste or treating the waste and managing the waste, and who follow the rules and guidelines which are issued by the central government or Central Pollution Control Board. Next definition is biological. Biological means any preparation made from organisms or microorganisms or product of metabolism, biochemical reactions intended for the use of diagnosis, immunization, or the treatment of human beings or animals in the research. So anything that related to the organism, okay, the living organisms, the microorganisms, and which undergo the process of immunization, vaccination, and treatment, that is biological one. Any waste that is getting produced in this process of treatment, we call it as a biological waste. Next, we know the biomedical waste, and we know the biomedical waste treatment as well. In the definition we have seen, there are other definitions including healthcare facility, which is nothing but a diagnosis and treatment or immunization of human beings provided irrespective of the type and size of the health treatment system. So any organization that you take in which the immunization, diagnosis of the condition, treatment goes on, it is nothing but a hospital or a healthcare clinic. Occupier means a person who is having a administrative control over the institution. Okay, so the institution is nothing but a hospital or a health clinic or the animal house or a pathological laboratory or blood bank, anything that is related to the medical service that they are producing. There are other terminologies which you can look into. So we'll just move on to the categories of waste. So here we have seen basically they have been classified into two: non-hazardous waste and the hazardous waste, as you can see in the slides. So non-hazardous waste is about 75 to 90% in the interaction according to the biomedical waste authoritative bodies. They are telling that non-hazardous waste is about 85. So only 15% of the waste maximum, the hazardous waste or the infectious waste that the hospital or any other major source is getting, giving or producing. So what is non-hazardous waste? It is about 75 to 90% of biomedical waste, which is characteristics similar to the domestic waste and non-risky in nature. They don't cause any harm. And this waste is generated mainly from the organization or maintenance of hospitals or healthcare centers. What is hazardous waste? It is about 10 to 25% average you can take. It is a waste that falls under the category of hazardous one because it causes the hazard to the human being or environment or to the animal. They include the infectious ones, they include the toxicity agents producing ones, and they're also about various category. Again, we can have a division of hazardous waste into different categories. So we will see as we move on. Okay, so we have other category also under the non-hazardous and hazardous waste. Under the hazardous, this is the classification that we have. Infectious waste, we have pathological waste, pharmaceutical waste, genotoxic waste. Infectious waste. Infectious waste is nothing but a waste containing the pathogens, which includes the excreta, laboratory cultures like the blood culture, isolation wards waste, like you are keeping a patient in isolation ward if they're infected, or you are calling them as isolation wards, and any waste that is getting produced out of those wards is one of the thing. Any swab that you collected a culture from, or any collected any body fluids from the patients, materials and equipment that have been used to the infected patients. Example, you can take n number of examples like ventilator machines or the ambu bags. Okay, so those are the ones. They're not called as infectious way, like we are not throwing them, because ventilators and the ambu bags are the examples which I gave, because they need to undergo the process of disinfection. We reuse to the other person. Whereas we can take NG tubes or suction tubes, any tubes that we are using or infectious contaminated ones comes under this category. Pathological waste, including the human tissues, fluids, any body parts like fibroids or amputated parts, blood and body fluids, which includes pathological waste. Pharmaceutical containing, they are expired medications or no longer needed medications, contaminated, including the bottles and gloves, or not the gloves, the bottles and boxes which we used for the pharmaceutical purpose. Next one, we have the genotoxic waste. They contain the cytotoxic drugs which are used basically for the cancer therapy. So which are the genotoxic medications? You all know that we use the, for the cancer, the chemical containing medications which we use for the cancer patients. So why are we calling them as waste, and why are we categorizing them under the hazardous waste means? So they are the drugs which can be used to cure the cancer or to kill the cancer cells, but sometimes they become hazardous and they try to kill even the normal cell structures of the human body. So that's the reason we have categorized them into that category. Next, we also have chemical waste. Chemical waste is, they contain the chemical substances, including the laboratory reagents. They are like, the reagents which you are using, like anti-serums and antibody titers which we are using in the lab. They are the chemical waste. Film developers in the radiation or in the X-ray rooms, disinfectants and solvents which we use, like the Dettol solution, the Savlon solutions which we have and we used for some patient, and we can throw. We need not to, just because it is disinfectant, we can't use it for another patient, or we can't redo the things. Okay, and the high metals, the heavy metals, which includes the batteries and broken thermometers, blood pressure gases, and containers, gas cylinders, gas cartridges, and aerosols. All these are categorized under the heavy metals category. And we also have the radioactive waste from radiotherapy. So see, these are the ones: unused liquids from laboratory research, the substances which are used in the laboratory, contaminated glassware, packages or absorbent paper, urine and excreta from the patient treated or tested for the uncapped radionuclides. Okay, we use so many types of radioisotopes inside the radiation in order to diagnose as well as in order to treat. Again, the radiation comes in the cancer treatment, in the treatment process, and the diagnostic process, we can use X-rays and other kind of material which we use in the laboratories, especially related to radiation. We can consider them as radioactive waste. Next. Okay, so these are the classifications which we have seen. In your textbook also they have given different categories. There is also a, what do you call, the schematic representation. Hospital waste has been classified under biomedical waste, which is general waste, and the other waste. Under the biomedical waste, there are yellow, red, white, blue categories of the bins they have given. So we will see this categorization of biomedical waste into different bins, where it goes in the next slide as we are moving on. Let's see what is biomedical waste management process then. Okay, so coming to the biomedical waste management process, it is a schematic representation which you can see here. It is highly essential since it includes various steps of the treatment, and as well as there are various risks it causes the human health as well as the surrounding ecosystem, which includes the plants and environment, and also the animals. Okay, so that is a reason we need to follow the professionalism or professional etiquettes in order to treat the biomedical waste, and where we need to avoid the hazard to the people who are handling the waste as well as the environment. So these are the steps given in the biomedical waste management, as you can see in the picture, where it mentions segregation, collection, transportation, and the treatment. Okay, these are the basic 4 steps which included in the segregation, means where you categorize them into certain color codes. Okay, first process is segregation, where you categorize them into different color codes. All the waste that is getting generated, you need to categorize them. Collection is after you separated them, you need to collect them into different treatment centers. And then transportation, how the biomedical waste vehicle comes to the hospital and how do they transport, what principles we need to follow while the transportation as well, what is the importance of biomedical waste logo during the transportation, and finally treatment, different methods which we use. Okay, so we will see one by one. First thing is segregation. So segregation, why it is important, as it is a first step according to the biomedical waste management rules 2016. It is given to avoid the mixing of biomedical waste with other, a container should be used or set aside with the color code. That is very important. The sorting or separation of waste into different categories is referred as segregation. So what is the meaning of segregation? It is sorting out or a separating of a waste into different categories, referred as segregation. So what it does, why it is important, it will decrease or minimize the risks in addition to the rate of managing and disposal. So it is a most important and critical step in biomedical waste management. Since it is a first step, it is very, very important. And we being the medical people, including the the doctors and nurses and people who are handling in the hospital into administration side, all as well need to know what are the categories and how we need to process them in the segregation. Next. Okay, so we will see the segregation point of view here. So it is a basic separation of different categories, as we have seen. According to the biomedical waste management rules given in 2016, it need to be segregated. Next. Just the picture. As you can see in the picture here, so there is a white one, different color codes it is given. There's white, there is red, and there is also yellow and blue, you can see. Okay, so you can even notice what are the items which are into different color codes. Okay, so in the white you can see all the broken ampules, the sharp agents, the needles and vials and everything which is broken. And coming to the red, you can see the gloves, urine bag, the blood bag as well. Okay, and all the plastic that goes over there, rubber and plastic. And coming to the yellow, you can see the kidney. Okay, and the blood. So body fluids and blood contaminated things should go into the yellow bin, the human tissues and all. Next one, blue, is general waste. So few hospitals follow green and few hospitals follow blue for the different categories of waste. 1 second. Okay, I repeat. So blue is not for the general waste. Here you can see above picture. Okay, so here the blue one, you can see the blue, the category you can see broken or discarded or contaminated glass, including the medicine vials, ampules, and expected those who are contaminated. So that's a difference. Coming to the practical and theory, when you look into the things, usually the blue bins are we think that the yellow bins are meant to be for the blood contaminated tissues and the organs. But if there are the glasses and the broken items which are there, need not to go into the sharp objects, which is a white bin. Basically, the ones which are not contaminated should go into the white one, but blue one, it contains the glass items only, but which are infected, like which is contaminated with the blood and body fluids, need to come into the blue category. So these are the different color codes which we have: yellow, red, white, and blue. So I'll just list down here what all the items will go into the yellow. Number one is it is there in 2.2 categories of the biomedical waste in page number 17 in your textbook. Human anatomical waste, that is human tissues, organs, you can see in the second picture as well. The extra categories and segregation also is given, that is non-infected waste, which includes the cytotoxic drugs and chemical waste, should go into the black one. And you can see the white bin, which is a smaller compared to the all other bins, and it also contains a solution called sodium hypochlorite solution. So these are the classification. As you look at the picture, I'll just read out the things which are given in your textbook. Yellow one, which is human anatomical waste, which includes human tissues, organs, body parts, fetus, um, and fetus in the sense like after the termination according to the guidelines given by the 1971, which is the MTP Act. And the animal anatomical waste also, it includes the animal carcasses, body parts, organs, tissues, including the waste generated from the animals used in experiments from the maternity hospital. Soiled waste, which is contaminated with the blood and body fluids. Example, you can take dressing, a cotton or a gauze pad, which is infected with the blood and body fluid, need to undergo yellow. Discarded or expired medications, which includes antibiotics, uh, discarded or expired medicines, which includes antibiotics, cytotoxic drugs, plastic ampoules, need to undergo yellow. Chemical waste, which includes biological and discarded disinfectants, chemical liquid waste as well, the silver X-ray, discarded disinfectants, formalin, discarded formalin, infected secretions, and aspirated body fluids, all these things, and microbiology and biotechnology waste. All these things should go into the yellow. Next one you have red, that is tubings and bottles, intravenous tubes, catheters, urine bags, syringes, everything should go in there. Next, fixed needle syringes as well. And white bins, as I said, fixed needles, needle from needle tip cutter, burner, and scalpels, blades, everything should go into the white. And blue, as I said, contaminated glass items and cytotoxic drugs. Okay. Next, you have general waste. You may be thinking general waste is not given over the biomedical. This is a category of biomedical and hazardous waste we are discussing. Move on. In the general waste, which in the hospital we can use, the green bin or a green dustbin, where newspapers and paper, cardboard boxes, plastic water bottles, aluminum cans, packaging material, food containers, organic and biodegradable waste, and construction and demolition waste, which includes the broken bricks, the cement. Those are the things which comes under demolished buildings and things. Okay, so that is not included in the biomedical waste category picture, but since you need to learn about it, because in the hospital there are other works also go on. Okay, so there we need to know what kind of a bin that we are supposed to use in order to throw the general waste. Okay, you can see even in the canteens, the hospital canteens, they use the green bin. So that's an example. Okay, so here categorization of healthcare waste in methods of disposal, it is given how we need to dispose them. It is under the biomedical waste management process. Okay, so here you can see the type of waste. They have given certain categories, like there are 10 categories of the waste are given, and which type of waste under category number 1. This is another type of a category. So basically, as we have seen in the first category, there are only 2: hazardous waste, non-hazardous waste. Next category we have seen 3, that is guidelines given in 2016, that is general waste, which is non-hazardous waste, and biomedical waste separately. And in that we have category of infectious and non-infectious. Again, this is a separate category which is very recently given one by the, the World Health Organization, the pollution control and central government and everything. So they have given these categories. There are 10 categories. We're going to see one by one. First one is category number 1, which is human anatomical waste, that is human tissues, organs, and body parts. So what is the treatment and disposal option that they have? So which kind of a treatment they should undergo? It is incineration or deep burial. Okay, incineration is you need to burn it, or you need to do a deep burial, like not the superficial, it should be deep burial, like where you bury it, you take out the mud and put the things over there. Second category is animal waste. The list is given over there: animal tissues, organs, fluids, the body fluids and blood, experimental animals which are used in the veterinary hospital and research centers and everywhere. They also undergo the same process, which is incineration and deep burial. Next one. Next, category number 3, it is microbiology and biotechnology waste. These are the ones which are generated from the laboratories, which includes the stocks and specimens, microorganisms, human and animal cell cultures, infectious agents from the research and industrial laboratories. So these are the ones getting produced from the microbiology and biotechnology waste, where they mostly are in the labs. And coming to the treatment option that we have, that is local autoclaving, microwaving, or incineration. Okay, so where we need to follow certain pressures. Autoclaving and microwaving we will see again under the category of the management techniques, how we need to do. But here we are just listing down what are the kinds of disposal or treatment options are available. Okay, how do they do? We will discuss as we move on into the further classes. So here, autoclaving, you just have to remember autoclaving and microwaving, where you use the temperature, they use the pressure, and they give the treatment. And incineration, you all know, that is burning the things. Next, category number 4, which is a sharp waste, which includes needles, syringes, scalpel blades, glasses, and everything. They include both used and non-used sharps as well. So here, chemical treatment we need to give for few. Disinfection is the disposal or treatment of choice. Autoclaving and microwaving, still we need to follow. Mutilation and shredding, so where you break down the sharps. Okay, there's a glass item, you need to shred it, you need to crush it. Okay, that is a treatment which we follow. Next, category number 5, here discarded medicine and cytotoxic drugs, which is category number 5. These are the waste comprising of outdated medicine, contaminated medicine, or discarded medicine. They also undergo the process of incineration, which includes the destruction and drug disposal in secured landfills. Landfills are like, it is not a deep burial, it is just filling the lands, superficial kind of a burial. Next, category number 6, it is soiled waste. Okay, soiled means contaminated, right? You can say the bed sheet is soiled if the patient urinated on the bed sheet, or if the patient leaked any blood has oozed out from the wound. I'm sorry, Ripe. The blood is oozed out of a wound, and you can call it as a soiled bed sheet. It's like that. Soiled waste, it includes the cotton, dressing, soiled plastic cast, the plaster of Paris. Like cast means the dressings and the materials that they have, and any lines, the IV tubings and all, bedding and other materials also which are contaminated with the blood. They also undergo incineration and autoclaving and microwaving. Next, category number 7, which is a solid waste. Soiled is different from solid. Soiled is contaminated. Solid is which is a material. Okay. So it is a generated item, again, disposal item, which includes the solid tubes and catheters and intravenous sets. And the treatment is chemical treatment we can give, autoclaving and microwaving, and we can use the shredding and mutilation. Next, 8, which is a liquid waste. This is, again, you can take an example of Savlon and Dettol solutions, okay, which we use in the houses, which we can use in the labs, which we can use in the isolation wards or general wards. Okay, these are the disinfected agents, housekeeping or disinfecting activities. Out of them, the waste is getting generated. So this can undergo chemical treatment, as well as directly we can throw them into the drains, the drainages. Next, 9, incineration ash. Okay, so we are talking about incineration, no, from all the kind of a treatment of options. So out of incineration also, the waste is getting generated. That is nothing but a ash. Okay, so where we need to dispose that, we can do the land filling, where you fill the land, like superficially you can bury it. Next, category number 10, which is a chemical waste. These are the chemicals which we can use in the process of biological and you know other treatments, which includes the disinfection and insecticides. This also directly, since it is a chemical waste, you can take an example of again a disinfections. You can directly drain them into the drainages, or you can do the secured land fillings for the solids. Okay, so these are the categories. Next. So these are the categories, the 10 categories which are listed, and which we have seen which category of the waste need to undergo the treatment. Okay, this is about the segregation which we have seen. Segregation means collection, separating them into the certain category of the color codes. So this is the first step of the management process. Okay, next one is collection and storage. So what is a collection? We will see. As you can look at the picture, how a person is collecting the waste with a bin, and the two pictures they have given, one with the cross mark and one with the proper method of collection, how we wore the PPE, the personal protective equipments, where he used the cap, the mask, and the gown, everything, and he even wore the shoe. Okay, the boots they give biomedical waste management people. I mean, the handlers, the biomedical waste management handling people, they have definitely been given all this equipment in order to handle the biomedical waste. So they need to follow. Look at the other person who is just dragging the, a bag with all kind of a different waste. That is a wrong method of collection. Okay, so we will see. So proper collection of waste from the sources and storing in safe and ventilated secured location is very, very important. The collection of biomedical waste involves use of different types of containers. The bins are placed in such a way that 100% collection is achieved. And sharp must always be kept in a puncture-proof container. The sharps must always be kept in puncture-proof container. We will call it as PPC, puncture-proof container. Like, then they should be a very thick, where a needle should not puncture and come out of that container. Okay, usually when you try to insert a needle into a bottle, like you can take a coconut oil bottle, when you pierce a needle, when you pierce something, it will definitely go through that. Okay, the containers which we are using in the hospital in order to collect the sharps should be the one puncture proofs. Okay, they're not supposed to be pierced with any kind of a sharps. That thick it should be. Okay, and they also should contain the disinfection inside, so that the treatment, one of the step of the treatment goes on inside. Next. Okay, so before we look into the storage, we can see this together. Let the picture be like that. We can see the collection and storage. There are few things which are given in the textbook. Never overfill the bins. That is very, very important. Proper collection should be done from the source itself, and the storage should be in a separate. The collection should from the wards, but the storage should be a separate area. Okay, all the waste shall be collected in the closed trolleys transported to the main storage point. Okay, so the collection of waste is happening in the wards, and once you collected the waste from each different wards, like you have a medical ward, you have a surgical ward, you have a ICU. Once you collected the waste from all the different types of wards, you need to store it in your local storage area. Like you have a storage center within your hospital building. It should be little distant. It should be within the hospital premises, but it should be little distant from the wards, distant from the healthcare treatment settings. Okay, so that is the storage. So waste shall be collected every day from the patient care areas, and waste in the hospital shall not be stored more than 48 hours in the main storage point. Okay, you have a storage point in your hospital, and you have a collection center, the wards. Collection should be done every day. Okay, collection should be done every 24 hours according to the hospital policy. You can even do morning, afternoon, and evening as well. Let the slide be the storage one. Okay, and the what do you call the storage point? As I said, it should be little distant from the hospital, so that thing should be emptied within 48 hours. Like you need not to keep the storage as long as you want, like 1 week and 10 days. It should be removed from that place within the 48 hours. Should not be more than 48 hours. And the bin shall be cleaned every day to keep it clean, avoid foul smelling and infections. So the bins which you are using over there you can see the bins, the yellow bin and red bin and the white, the puncture proof one where the needle cutter, and you also have the blue bin. So these are the ones which are given. You can see the top of the bins, they are secured with a proper same color coded covers. Okay, so need not to throw the waste into the bins directly. That is secured a cover. So the cover itself to be taken up and uh, you know uh, you can drop it into the transportation trolley. Okay, so that is a process that we need to take care. A bin shall be cleaned every day. So these bins which you can see in the picture need to be cleaned every day, and under no circumstances any infection waste should be mixed with non-infection. So no matter what, never should mix the infected waste with the non-infected. And disposal items collection, like including IV bottles, catheters, rubber gauze, should be undertaken when they have been mutilated. Like you have to cut. Okay, mutilation is nothing but cut. So while you're throwing a IV tubing into a red bin, okay, make sure that you mutilate it, you cut it and then throw it. Okay, so while you take out from the bins and put them into the transportation trolley, see that whether it is mutilated properly or not. That is very important. And coming to the needles, the sharp agents, they should be dipped in 1% hypochlorite solution at least for 30 minutes. Okay, you can't take the sharps as you want. The sharps as you're disposing, as I previously mentioned, the white bin, which is a puncture proof container, should be filled with 1% hypochlorite solution. That will maintain the disinfection of all the sharp objects. Okay, so these are the principles we need to follow uh, before we actually transport. And coming to the storage, as you can see, once collection is done, uh, occurs in the biomedical waste is stored in proper place. Segregated waste and different categories need to be collected in identifiable containers. Storage should not exceed 8 to 10 hours in a big hospital, more than 250, and 24 hours in nursing homes. It is given different category of the hospitals, but it should not cross more than 48 hours according to the guidelines. Each container may be clearly labeled and show the ward or room where it is kept. The reason of this labeling is very, very important. It may be necessary to trace the waste and back to its source. Besides this, storage area should be marked with a caution sign. That is very, very important. There are other things are given here in your textbook. The central storage area in the hospital, sufficient storage capacity should be there. At least the storage point should contain a space of collecting 2 days of waste at once. I mean, 2 days of waste it should contain. Okay, and refrigerator storage items also should be available in order to store some bulk kind of items, especially the human anatomical waste. Okay, so it should be properly storing facility can be provided with that. Okay, next one, transportation. Okay, so transportation, during the transportation of waste, either the central storage or to the final disposal, the following points should be very, very remembered. Okay, so there are 2 steps of transportation takes place here. The transportation from the ward to the storage point which you have in your hospital, and the transportation from the storage point within the hospital to the treatment area. Each hospital should have a biomedical waste management process center. So we have examples of JJ centers. So we have different centers which we have under the central police. So under the okay, so we have different hospitals given the authority or authorization to use different centers which are given in the city of that particular area. Like they have been authorized under GHMC, like government, central government and municipal corporation, as well as they also undertake the project of pollution control, central pollution control. So like that we have different treatment options are there, treatment centers are there within the city. So there are 2 steps, as I said. Number 1, from the wards to the within the hospital storage point, from the storage point to the treatment center, which is outside of the hospital. Okay, there are 2 steps we need to follow. So here The ensure, there are principles given which are there in your textbook as well. Ensure the waste bags and containers are properly sealed and labeled. Okay, so it is very, very important that way each should bin as well as each bag should be labeled. Bags are picked up from the neck and placed so that the bags can be picked up by the neck again for further handling. Okay, so each bag, you're not supposed to carry it from the down, need to carry over the neck area of that particular bag. And manual handling of the bag should be minimized to reduce the risk of needle pricks and injuries and infections. Okay, you are not supposed to carry it manually. We need to use the gloves to carry them. Then use PPE. It includes a face shield, goggles, cap, gloves, and mask, face mask, boots, and apron. Then biomedical waste should be kept only in the specific storage area. After removal of bags, clean the containers, including the lid, with appropriate disinfectants, means the bins. Then waste bags and containers should be removed daily from the wards and OPDs. Waste bags and containers should be transported in a covered wheeled containers. Okay, so this is a transportation from the ward to the within your hospital. Okay, so you can see the first picture under the pink, biomedical waste collection and transport. You can see the person handling within, two pictures are given again, one with a yellow, the color. It is with a cross where the waste is just dumped into the transportation trolley and is pushing it, and you can see the leak as well at the down. But another person is wearing all the PPE, wearing gloves, cap, apron, even shoe or boot, and the transportation trolley is sealed properly. There's no leakage of the waste. Okay, and this is within the hospital. The first picture is within hospital to the within storage point of the hospital. The next one, you can see the association of biomedical waste transportation. That is where you have a separate treatment center which is there within the city. Okay, from the hospital storage point to the particular treatment area that they will transport. Okay, the vehicle is particularly marked with the label, as well as you can see the logo, the biomedical waste logo, you can observe over there. So this is transportation to final disposable point. Final disposal point. Okay, so this transportation from healthcare establishment to the final disposal is closed motor vehicle. You can see the truck which is closed. It is desirable as the prevent spillage of waste on the way. Vehicles used for transportation of biomedical waste must have the biohazard symbol, as you can see. So it is very, very important. Okay, next one. Okay, these are the principles which I already mentioned, where the collection of waste need to be transported in trolley. They should contain the bags and container, and labeling should be there. Even the transportation trolley also should have the logo, and they are properly closed with the lids, and it must be properly enclosed to prevent the accidents. Driver must be trained in the actions which must be followed in the case of accidental spillage. Okay, in the sense, if there is a spillage, he must know how to collect that or how to dispose that. So they need to also have a training related to what is the treatment of option to that particular waste and how we need to follow. Next. Okay, these are the trolleys. Trolleys are used in order to transport different categories of waste. Like transportation items which we can use. Number one is trolleys. Number two is wheelbarrows. Wheelbarrows are where you push the things. Like they are given the wheels and you can push it. This we can use within the hospital, not in the outside the hospital. Next, dustbins which we can use. You all know the dustbins and different color codes which we have seen. They must be cleaned, as I said. Once you remove the cover by holding the neck of the the color code waste bag, the bin which is there need to be cleaned immediately and dried, and then you put the another plastic bag back, which are very chlorine free, and color codes also should be followed according to the law. Next. Okay, so again color codes are given, yellow, next, continue, which are contaminated. Red one is disinfected contaminated plastic. Black is for the toxics and cytotoxic drugs, and blue is for the category number 4 and 7. So this is same thing which we have seen 1 to 10 categories and which bin it has to go. Next. Okay, this is a similar one again. See the details of treatment, what are the different types of treatment that we have in the management process, and how each treatment is indicated to different kind of biomedical waste that we have studied. Okay, so coming to the treatment and disposal, which is there in your textbook as well, the description. Here in the slide, you can see which kind of a waste that goes into different types of treatment. Like for example, first thing is it is mentioned is incineration. Okay, on the whole, if you look at them, the treatment and disposal, we have incineration, we have autoclave, we have microwaving and hydroclaving, followed by shredding. Then we have deep burial and landfill. So these are the 5 mentioned treatment of biomedical waste or management of biomedical waste techniques we have. So we will see one by one. As we see, you can just look into the content which is given. First method is incineration. So incineration, which I already clearly mentioned, that it is nothing but burning the things in a simple way. So it is given in the textbook that incineration is a high temperature of dry oxidation process. So we all know that incineration means like burning out. The basic fire that what is happening here in the biomedical waste management technique, the organic substances are becoming inorganic, as well as the combustible matter is becoming incombustible matter. Okay, where they match up with the oxygen and they become fire, right? So this is a process goes on in the incineration one. So in which kind of a waste that goes in, this method is usually used for the waste that cannot be reused, recycled, or disposed of in a landfill site. Okay, so which kind of a waste that should not be landfilled and should not be reused again and should not be recycled also. So those kind of a waste which undergo the incineration process. Simple way to remember that it is an oxidation process which makes the organic substances into inorganic. Or organic substances, what is the main difference of organic and inorganic substances? Are the larger molecules are the organic and the smaller molecules are the inorganic. And in the organic, we have in the chemical way, you can see that it contains the carbon. Inorganic is doesn't contain the carbon. So that is a one. Combustible and non-combustible ones are which are related to the fire things, the material which goes under the fire. This is about the incineration. Second one we have is autoclave. Autoclave is a machine. If you are working in a hospital, you must be knowing, especially if you are working related to the sterilization area, CSSD and all. So you must be having an idea about what is autoclaving. So it is a machine that uses the high temperature steaming, okay, for every specific period of time, a very specific period of time and temperature to kill the pathogens. So it includes the pressure. It also includes a particular temperature. Both pressure as well as the temperature both act on the pathogens and organisms, and they try to kill the bacteria and the virus. So this process is a process of disinfection and waste prior to the final disposal. So before we actually finally dispose the material, we send certain items into the autoclave. We also use the instrument for autoclaving different types of material, which you can see the waste sharps. Okay, before we actually throw the sharps, it need not to be reused. Some of the items like steel articles are there, those can be reused, but needles and all, we are not supposed to be reused. So before you throw them, you better to autoclave first and then throw. Why are we doing that? Because if you throw them raw like that, if they're contaminated with the blood or body fluids previously, and if you're throwing on the or landfilling the things, what happens is the infected pathogens will be still on the material, on the needles and whatever the material, the sharp objects, the scalpel blades and all. So what happens if other person touches it? There is a chance of having a contamination. So that's the reason we need to autoclave the material first and then you go for a final disposal. And there are few things like steel articles of trays and the kidney trays and the bowel you use in the dressing and other kind of a sets which we prepare in the wards. Those things are reused. Next one is microwaving, hydroclaving, or followed by shredding. So here microwaving is also a process which disinfects the waste. It is mostly the moist kind of a heat we follow. and steam also generated by microwave energy. So there's a energy which happens with the steam, as well as there is a moist heat. And a high heat system employ combustion, and as well as high temperature. Yeah, so here there is a high heat, like the temperature should not be you know, it's not like we can put the temperature however we want, but there's a specific high temperature according to the regulation it is given that we need to follow, and which also sometimes use the combustion method with the help of high temperature. So what is happening here in the microwaving, like simple way to tell, we use the microwave, right, at a home, like to prepare some baking things and all. So it's a simple example that we can use where it releases the heat. Sometimes it burns the material, okay, with the high temperature. There's no fire, okay, there's no fire, but you can see the bread. If you put a certain temperature and put the baking, you know, the dough into the microwave oven, what happens, it becomes a bread or it becomes a cake or something. But if you continue keep it for a little longer time other than the specific time, it become burnt. Similarly, same thing happens. That is the effect of combustion. Okay, so this high temperature need to be used in the microwaving. Second one is hydroclaving. Hydroclaving is a cylinder, a jacketed cylinder, a big cylinder which is actually packed one, a vessel with shredding system inside. So it has a shredding system inside. What is shredding? Breaking of things, okay, cutting the larger pieces into smaller pieces, we call it as a shredding. So this hydroclaving material, which is a larger cylinder which has the shredding system inside of it, and waste that is loaded into the door on the top of the vessel, high temperature steam. So it also maintains a steam between 121 to 138 degrees centigrade, and 5 bar steam pressure is used. And then shredding, what is a shredding which I mentioned? It is nothing but a process of the waste is de-shaped or cut into small pieces. We cut down the shape and we cut down the material into smallest pieces. So these are the three things. Here again, the things which undergo this process of microwaving, hydroclaving, and shredding are non-infectious biomedical waste are the ones which undergo this process. Next one is deep burial. So what is deep burial? Burying, like we have to dig the, you know, the land, and then deeply we should burial. So why are we mentioning deep is the trench or a pit should be dug about 2 meters deep. Okay, it should be 2 meters deep. That's the reason we are calling it as a deep burial. And it should be half filled with waste and then covered with the lime within 50 centimeters of the surface. So first you have to dig the land into 2 meters. Then half of the pit should be you know, covered with the waste. It is thick. Before filling the rest of the pit with soil, it must be ensured that the animal do not have access to the burial site. That is very, very important. And cover galvanized iron and wire meshes may be used. Okay, so what are we doing here? We are not only disposing the waste, but we are also securing the area, do not cause any harm to any other animals which roam over there. Okay, so simple way that you have to bury it, like you have to dig it for 2 meters deep, and then put the waste in it and cover it with the 50 centimeters of lime, and then cover the topper layer with the soil. Okay, and surrounding you can put some meshes, iron meshes and all, so that the animals will not have an access into it. Then landfilling is also a method of disposal where a huge pit is made in an open low lying area. So there is no specific how many meters that we need to dig the land or make a pit. It is just filling the land. So before filling the rest of the pit with soil, it must be ensured that the animal, again, the waste is collected here in the huge trucks and dumped into the pits. Once the pits are filled, they are covered with the soil left for the decomposition. So it is just a topper layer. Okay, so you have to remove some of the soil on the topmost superficial layer or on the surface of the soil, then put all the material over there and again cover it. It is a process of decomposition. We need to allow the waste to undergo the decomposition. So these are the techniques that we use in the process of biomedical waste management. So we will see the healthcare waste management strategies during the pandemic situation. So how the healthcare waste management strategies were applied during the COVID-19 period. So according to World Health Organization publication on February 1st, 2022, thousands of tons of extra medical waste from the response to the COVID-19 pandemic has put a tremendous strain on health and waste management systems around the world. So we all know during the COVID-19 pandemic situation, there were a lot of materials we used in order to save the patients and treat the patients. So there were both the general waste was there, and mostly of the infected waste also, because we considered every person is with the infection. So there is a lot of tremendous strain was there on the medical and health waste management system around the world, which also threatening the human and environmental health, exposing the dire need to improve the waste management practices according to the new WHO report. So what are they saying? Because of the pandemic situation, because it was a high infected virus that that was happening at that particular period. So basically, the more pressure is on the biomedical waste management department, where they need to produce a lot of reports, and they need to produce a lot of guidelines in order to prevent the cross contamination among the patients, and how the biomedical waste management need to be done under the process. Continue. Next. Okay, so according to that global analysis COVID-19, there is there are some statistics are given here. The WHO global analysis of healthcare waste in context of COVID-19. Approximately 87,000 tons of PPE was produced between March 2022 November 2021. Okay, the personal protective equipment, that is also considered waste, because after the use they are going into the waste. Most of it is expected to end up as waste, definitely, because we received also the instructions like mask should be wore only for 24 hours, and there should be a double mask also. We are not supposed to be reused again, and again the rules have come, it is only used for 6 hours. Okay, and whenever we are treating, the complete PPE should be there on the, whenever we are trying to treat the patient also, the complete PPE should be there. So all those things, so that's the reason they produce a lot of tons of PPE that particular period of time as a waste. And the report also lays out the recommendation. The report also lays out the recommendation for integrating a better, safe and more environmentally sustainable waste practices have been given by the government of India, as well as the biomedical waste management system, into the current COVID-19 response. The future pandemic preparedness efforts also have been made. So that once it happened during 2019 and continued 20 and 21 as well. So they also not made an effort in that particular time of period, but it also gave us a learning how to become so prepared enough to combat that particular virus, or to combat that particular infection if it comes in the future. Okay, so that is like a practice in the spirit of building back together. So that also made up with the help of World Health Organization. And the recommendations including here using a eco-friendly packaging and shipping, safe and reusable PPE, recyclable and biodegradable materials, investment in non-borne waste treatment technology such as autoclaving, reverse logistics, and to support the centralized treatment and investments have been made in the recycling sector to ensure that materials like plastics cannot have a second life. So there are which kind of a material can be reused and which cannot have a reusable nature. So those guidelines were given in the process of that particular period of time. Next. Okay, so these are the ones which we have seen, the recommendations which are given: eco-friendly packaging, shipping, safe and reusable PPE, recyclable and biodegradable material can be used. Investment should be made in non-burn waste treatment technologies like autoclaving, not supposed to burn more of a things, and reverse logistics also needed a support to centralize the treatment and investment in the recycling sector. Next. Okay, so according to these guidelines which are given, so there are other countries. Okay, the healthcare waste management strategies adopted by different countries during the pandemic, not only in India. What are the strategies have been applied in different countries also, like by China, segregated and packaged, disinfected, 0.5% fluorine solution, packet, double bag and temporary store. Okay, it's not like we have learned now, like in the previous class, like the waste need to be carried in a bio medical waste label, and the color code should be there. So that is a single cover that we have learned till now. But from the COVID-19, it is given the double bag should be there, and double packing should be there, and the waste need to be disinfected first, the packet, with the 0.5 chlorine solution, and sterilization using more than the incineration process and all, like autoclaving and radiation techniques have been used more. Incineration also was there, and still it is there. Cement claims also, like not only you are filling the land and deep burial, but cement claims also have been into the practice. Then Philippines used a special registered transportations, treatment and storage and disposal facilities also. They followed and adopted in these kind of countries. Next. Then other countries, including the Jordan, same principles have been followed, and reduction of unnecessary healthcare waste, isolation of regular waste from hazardous waste, and proper treatment in order to reduce the risks to healthcare workers and society. So these are the techniques used by different countries, like reduction of unnecessary healthcare waste means, though we have different methods to use, though we have different transportation facilities used, but the source have to be cut down. We are not supposed to produce that tons and tons of waste, which is also a good measure of controlling the waste. Proper treatment need to be used. Like we can't send everything for the landfilling, we can't send everything for the deep burial, we can't send everything for the incineration. So we need to follow which is a prompt treatment for the right material. Then overall, there is a recyclability and reduction in the landfilling should also be considered to aid sustainable management of healthcare waste during COVID-19 pandemic. So the recyclability and landfilling reduction. Okay, so more process of recyclability and reduction in the landfilling. Why we need to reduce the landfilling? Because it contains a decomposition and there is a chance of spreading into the environment. So that has to be cut down. So that is one of the element which we learned during the COVID-19 pandemic period, and it is also adopted by other countries. Next.
That's it, ma'am.
Okay, yeah, it is done. Okay, I'll summarize.
Okay.
A slide unchandi alage. Okay, so this is how the strategies have been helped out during in India as well as in the pandemic, and how other countries also have adapted the same techniques and also implemented and reduced the not only the amount of waste that is produced, but also practiced the safe disposal and safe treatment, so that it will not affect badly to the public as well as to the environment and ecological way also. So on the whole, in this unit, we have learned about what is biomedical waste and what is a classification of waste, including general waste, hazardous waste and non-hazardous waste. And we have seen other classification, including the infectious waste, pathological waste, sharps waste, chemical waste, pharmaceutical waste, cytotoxic and genotoxic and radioactive waste also. We have seen with the table examples and color coding systems as well. And we have seen what is a healthcare management, healthcare waste management, and what is a process like, including the segregation, collection, storage, transportation, and disposal. And under the disposal, we have seen different techniques of incineration, landfilling, deep burial, shredding, and autoclaving and hydroclaving. So this is all about the second unit, and next we'll move on to the third unit. Thank you.